You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. He is the go-to, he's Idaho's go-to dentist for implant dentistry. Dr. Stott, welcome to the program.
Thank you, Randy. Appreciate it.
Now, you brought a stack of photos, so we're going to try to get to as many of those as possible. But for people that don't know your practice, like who's the typical dental implant patient?
Really good question, Randy. I would say there's primarily two types of people that come into my practice to see me. The first one would be people that have been in dentures for a really, really long time. Or maybe it's a new experience for them, but they all realize that they just don't like it. A lot of these people, when they had their teeth, they just weren't in really good shape. So there was a lot of bleeding when they would brush, when they tried to take care of them. They would try to brush it and maybe there'd be some movement in the teeth. They got to a situation where they couldn't talk to people, they couldn't smile. They just felt kind of the weight of not having good teeth and the embarrassment of it. And so they transitioned into dentures. And what happened is they hate the dentures. They hate that there's something on their palate. They hate that they can't taste the food that they want to taste. Okay. They hate that they fit really, really weird, right? So they hurt, they have to come back for adjustments. So for those people, they come to us, they have their denture in hand, and they want a better solution. And what we do for them is we give them teeth that are hooked into implants that no longer ever come out.
That's very nice. Who's the second group?
The second group of people are people that have visited the dentist throughout their whole life. They're the people that, from in their 20s and 30s or whatever it might be, they were going to the dentist, they were getting the fillings, they were getting root canals when they needed to get root canals, they were getting crowns, they were doing everything that they were told to do. But in the long term, it just didn't work out for them. And so they're in a situation where they're being told by somebody, you have to move on to a denture, and they just don't want to. They feel like, oh, me keeping these teeth that I have, even though they're breaking, they're falling apart, they might be discolored, they might look funny, keeping this is better than going directly to a denture. And so those people come to me looking for an option to skip the denture and go straight to those fixed teeth that we talked about.